Welcome back to the Victory Education Lounge, everyone. I'm your host, Maurice, and today we're diving into part 20 of our series on insulin resistance. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this vital information. Today we're exploring how to identify insulin resistance, symptoms, and diagnosis. We'll delve into the signs that might indicate insulin resistance, the diagnostic processes, and what you can do if you suspect you might be affected. We'll discuss symptoms, diagnostic tests, and management strategies, along with their pros and cons, and provide real-life examples to illustrate these points. Insulin resistance can be a precursor to several health complications, so understanding its early signs is crucial for timely intervention. In today's session, we will explore the symptoms that might indicate insulin resistance and discuss the diagnostic processes involved. We'll also touch base on what steps you can take if you suspect you might be affected. We aim to provide a comprehensive understanding of symptoms, diagnostic tests, and management strategies, along with their pros and cons. To make this information more relatable, we'll include real-life examples that will help illustrate these points. So without further ado, let's start by understanding that insulin resistance often develops silently, making it crucial to be aware of potential symptoms and risk factors. Here are 10 key symptoms and diagnostic indicators of insulin resistance. First up is increased waist circumference. Excess abdominal fat is a strong indicator of insulin resistance. Consider Sarah, a 45-year-old office worker. Despite maintaining her weight, she noticed an expanding waistline. Second, we have high fasting blood sugar levels. Even if these aren't in the diabetic range, they can still signal insulin resistance. Take the case of John, a 50-year-old whose fasting blood sugar of 105 milligrams per deciliter prompted his doctor to advise monitoring insulin sensitivity. Next is elevated triglycerides. High levels of this blood fat are often associated with insulin resistance. Maria, a 38-year-old with triglycerides of 180 milligrams per deciliter, found out that this could be a sign of metabolic issues. Low HDL cholesterol, the so-called good cholesterol, is our fourth symptom. Low levels can be an indicator of insulin resistance. Tom, a 55-year-old with an HDL of 35 milligrams per deciliter, was surprised to learn this could relate to his insulin function. Fifth, we have skin tags. These small soft skin growths are often seen in people with insulin resistance. Lisa, a 40-year-old who developed multiple skin tags, discovered this could be more than a cosmetic issue. Acanthosis nigricans, dark velvety patches of skin often in body folds, is a sixth symptom indicating insulin resistance. David, a 60-year-old with darkened skin on his neck, learned this was a potential sign of metabolic issues. Seventh, we have polycystic ovary syndrome, or PCOS, in women. This condition is strongly associated with insulin resistance. Emma, a 35-year-old diagnosed with PCOS, was advised to have her insulin sensitivity checked. Eighth, fatigue and hunger can indicate blood sugar fluctuations, a sign of insulin resistance. Mike, a 42-year-old experiencing post-meal fatigue, learned this could be related to insulin function. High blood pressure, our ninth symptom, often coexists with insulin resistance. Janet, a 50-year-old with persistent high blood pressure, discovered its potential link to insulin resistance. Lastly, having close relatives with type 2 diabetes increases the risk of insulin resistance, making family history our 10th symptom. Robert, a 58-year-old with diabetic parents, was advised to monitor his insulin sensitivity closely. These symptoms can be subtle and easily overlooked, so it's essential to pay close attention to changes in your body. They may seem unrelated, but together they form a pattern that could indicate insulin resistance. Remember, awareness is the first step in managing any health issue. So keep an eye out for these symptoms and don't hesitate to consult your healthcare provider if you notice any changes. Stay tuned for the next part of this series, where we'll explore diagnostic indicators of insulin resistance. We're all about empowering you with knowledge to take charge of your health. Until then, stay healthy, stay aware. These symptoms can be subtle and easily overlooked, so it's essential to pay close attention to changes in your body. Now let's discuss some diagnostic tests and management strategies. First up is the fasting plasma glucose test. This is a simple, widely available test that measures your blood sugar levels after an overnight fast. However, the cons are that it may miss the earlier stages of insulin resistance. Despite this, it's typically used as an initial screening test due to its simplicity and accessibility. Next, we have the oral glucose tolerance test. This test can detect insulin resistance earlier than the fasting glucose test. It involves drinking a sugary solution and having your blood sugar levels tested over a 2-hour period. However, it's more time-consuming and less comfortable than the fasting test. The strategy here is to use it when the fasting test results are inconclusive or when the patient has symptoms of insulin resistance despite normal fasting glucose levels. The third test is the HbA1c test, which measures your average blood sugar levels over the past 2 to 3 months. It's a convenient test as it doesn't require fasting. However, it may not be as sensitive in detecting early insulin resistance. The strategy here is to use it in conjunction with other tests and to monitor long-term blood sugar control in diagnosed patients. The fourth diagnostic tool is the Insulin Resistance Index, calculated using the homeostasis model assessment, HOMA-IR. This test uses fasting insulin and glucose levels to estimate insulin resistance. However, it requires a more complex calculation and is not routinely done in all labs. The strategy here is to use it in research settings or when more precise information about insulin resistance is needed. Finally, we have the lipid profile test. This test measures various types of fats in your blood, including triglycerides and HDL cholesterol. High triglycerides and low HDL levels can indicate insulin resistance. The downside is that it doesn't directly measure insulin function. The strategy here is to use it as part of a comprehensive metabolic profile to assess overall cardiovascular risk. As for management strategies, lifestyle changes form the cornerstone. These include regular physical activity, a balanced diet low in refined carbohydrates and high in fiber, and maintaining a healthy body weight. Medications may also be used when lifestyle changes are not enough to control blood sugar levels. These include metformin, a drug that reduces glucose production in the liver and improves insulin sensitivity. In conclusion, there are several diagnostic tests available to detect insulin resistance, each with its pros and cons. It's important to consider the individual's symptoms, risk factors, and test results in making a diagnosis. A healthcare professional can guide you in choosing the most appropriate test and management strategy. Remember, early detection is key in managing insulin resistance effectively. We've covered a lot of ground in this video discussing the symptoms and diagnostic indicators of insulin resistance. We've learned that increased waist circumference, high fasting blood sugar, elevated triglycerides, low HDL cholesterol, skin tags, acanthosis nigricans, PCOS in women, fatigue and hunger, high blood pressure, and a family history of type 2 diabetes can all be potential red flags. It's crucial to remember that early detection is key in managing insulin resistance, and these symptoms are the body's way of signaling that something might be off balance. If you or someone you know exhibits these symptoms, a visit to a healthcare professional for a diagnostic test is a wise step. Knowledge is power, and understanding these symptoms and diagnostic indicators can be a powerful tool in maintaining good health. Thank you for joining us for this exploration of how to identify insulin resistance. I hope this information helps you understand the signs to look out for and the steps you can take to maintain your metabolic health. Remember to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Stay tuned for our next video where we'll discuss innovative approaches to managing insulin resistance. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice or to replace consultation with a qualified healthcare professional. Always consult your doctor if you have concerns about your health or before making any changes to your diet, exercise routine, or medical regimen. Thanks for watching, and we'll see you in the next video.